Welcome, and thank you for attending today's seminar. Let's banish chronic pain before it starts. Or we could call it, let's get you out if you're already stuck. My name is Gillianspeak. I'm a physiotherapist. I've been practicing for just over 20 years. And along the way, I've developed some skills in manual therapy. I'm a fellow of the Canadian Academy of Manipulative Physical Therapists, in gun intramuscular stimulation technique for chronic pain, as well as I'm a yoga therapist. And because of these tools, I take a whole person approach to healing, mind, body, and spirit. First, some housekeeping. If you're new to webinars, try this first. Choose your audio, either by using your computer's own speakers or by telephone at this number here and using the access code. I'd like you all to try the My Mood icon to let me know how you're doing through the meeting. At the end, we'll have a question and answer period, and you can raise your hand so I'll know you have a question. I want you, everyone, to know the power and impact they have inside themselves right now on their healing and well-being. You can enhance the effects of whatever treatments that you're already getting. Most times, when we look at a pain problem, we try to find the source and fix it. And most times this works, but sometimes it doesn't. We need another way of thinking and looking at a problem. This one causes physiological changes in you that make your body more receptive to the treatments that you're doing and make you tend towards healing. Gillianspeak is a mindset where we see and approach our bodies in terms of systems and processes. And we recognize these systems that are intelligent, learning, interactive, and responsive. Our bodies are designed to be well, to heal, and to thrive. The principles that we use are identical to the ones that we use for success in any area. We just apply them to our bodies. Today, we're talking about banishing chronic pain or getting out of it. When is the best time to treat chronic pain? The time to treat chronic pain or to solve any problem is before it becomes a problem at all. Unfortunately, most of my chronic pain patients come to me months and sometimes years into their issue. By the time we wait until our injury or pain is chronic, then the injury itself is only a small part of the actual problem. There are other, much bigger issues that must be dealt with before even getting to the injury part. You need to know these things, or else you'll have a lot of difficulty working with chronic pain. You need to know about the stages of healing of an injury and what to do to maximize each stage. You also need to understand about neuroplasticity. You need to understand that the nervous system itself changes. You need to know how it works against us and how we can make it work for us. You need to know the psychosocial risk factors. There are 4 key risk factors that will interfere with rehabilitation. Now, this is just a guideline. Of course, there are structures that do take longer than 3 months to heal. Lumbar disc protrusions and herniations, knee meniscus injuries, and shoulder rotator cuff tears. But what these structures have in common is that they don't have a very good blood supply, and that's why it takes longer to heal. Nevertheless, they do go through stages of soft tissue healing. It's important to be empowered by knowing roughly the stages of soft tissue healing, so you can know what activities are safe to do, reasonable, and even required for a given time in the healing process. When you know what stage of healing you're in, you can work more effectively with your healthcare practitioner so that you can bias the healing process at each stage to maximize its potential. The biggest mistakes that I see people make occur because people do not understand that healing is time-defined. Did you know? This means that it occurs on a set schedule, and each phase of healing has a window of opportunity that you don't want to miss. Each phase of healing sets the tone for the next phase, so that the better job you do at the first phase will give you a head start for the second. Unfortunately, it also means that if the first phase is done poorly, then you'll be falling behind for the second as well. Remember, with healing, you don't get your time back. Inflammation is the first phase of healing. It lasts for about 0 to 7 days. You might think that inflammation is something bad that you need to get rid of, right? For example, when we're inflamed, we take anti-inflammatories to get rid of the inflammation. The Gillianspeak method and mindset is to squeeze every step of the way for everything that will benefit us. Inflammation is a normal part of healing and is a very important part of the entire healing process. The key here is to control and direct inflammation and not squelch it entirely. The injured area must be allowed to be cleaned up and prepared for repair. Think about a demolition crew and what has to happen before something new can be constructed in the old building's place. Bits, pieces, and trash, maybe even toxic material like asbestos, need to be cleared away. If this isn't done properly, how well can the construction take place? You only have a short period of time to do this, up to 7 days. The best management is one that promotes blood flow without excess heat. This is why the acronym RICE is good, but it is not a hard rule either. Remember, R stands for relative rest. It is not total immobility, and the earliest opportunity that you have to begin movement, the better. It will stimulate blood flow, flush away swelling, and help pain receptors. A professor of mine in physiotherapy school often said, "Early motion is the best lotion." Repair is the second phase, and it lasts up to 12 weeks. Remember I said the Gillianspeak method and mindset is to squeeze every step of the way for what will benefit us? The key to this phase that you may not know is that your body heals according to what it is told it needs to do. And it heals regardless of what you tell it to do. It is very hard to have to break it to someone that they missed their repair window and healed up stiff, weak, and painful, but that they are healed up just the same. This is the critical window that when you need to regain your mobility, strength, balance, and function. The best management is one that promotes these factors and minimizes compensatory patterns, usually guided exercise and return to work plans. Especially if your rehab is on hold because you are waiting for an MRI or a specialist appointment, it is so critical to understand that the clock doesn't stop ticking. There are still many things that you can be doing to at least prepare you for surgery if it is needed. Ask your healthcare provider all about this. Remodeling is the third phase, and it can last up to a year and even more. While healing, it continues to occur beyond the repair phase. The remodeling phase is a very slow process and is really about solidifying what has taken place in repair. By now, if you haven't gained your function back, it will be very difficult. Not impossible, but it does make the job much harder. Another reason not to be idle while waiting for tests and appointments, which could be months away. After about 3 months, the treatments and activities that were appropriate for you in the beginning are no longer beneficial. I still get chronic patients asking for ultrasounds, and these can even be detrimental to your progress. At this stage, it is most important to be engaging to the greatest extent possible in your life role activities. Have you heard of neuroplasticity? It basically means that your nervous system has the ability to change. Another error that people make during the healing process occurs because of a lack of understanding of how the nervous system works, which isn't hard to do because even experts in the field still don't fully understand how the nervous system works. So how can you be expected to? But what we're talking about in particular is the pain system and the autonomic system. Do you know that your nervous system is a learning system? Like anything that you learn, the more frequently you practice something, the better you get at doing it, until that skill becomes automatic. Likewise, your pain system can become so good at sending and receiving pain signals and running pain behavior patterns that after a while, your painful state becomes your new normal. That's the bad news. The good news is that it can also be taught to desensitize and normalize again by deliberately disrupting and interfering with the pain cycle, using as many inputs into the system as you can. Breathing, relaxation, posture, facial expression, words we say and how we say them, visualizing good outcomes are just a few of the things that impact the nervous system. It is important to control your pain. You may not be able to eliminate it, especially in the acute stages of an injury, but it will serve you to do the best that you can. Many of my patients will tell me that they were prescribed pain medications, but they only take them when they really, really need them. Or they don't take them at all because they don't like to take pills. Or they don't want to mask the pain. If you have been prescribed medication, it is important that you are also given a dosage. As needed and PRM is not adequate guidance. Ask your doctor exactly how you should take your medicine to get the maximum benefit. As your needs change, then so should your dosage, under the guidance of your doctor. Here's the problem. You get what you tolerate. If you have a high tolerance to pain, then you will get high pain levels, and then you teach your body that you need higher and higher pain levels to get a response from you. Getting good control of your pain also means that your brain receives fewer danger signals that it needs to respond to. Pain responses include increased muscle tension, spasms, increased blood pressure, stronger emotions and moods like fear, frustration, and anger, increased stress hormones, decreased endorphins. You may have noticed that the pain response is very similar to the fight or flight response. In this response, our healing and repair systems are actually turned down, which is the exact opposite of what we are trying to achieve. Encouraging and practicing the relaxation response is extremely important for training a calm nervous system. Part of training your pain system, especially if it has started to get sensitized, is to be able to rationally respond to your pain signals. You can do this if you understand your stage of healing as to how to interpret your pain signals and how to reasonably respond with them. How you respond to pain signals when you are in an acute stage of healing and tissue integrity may still be compromised should be very different to when you are in the repair and remodeling stages, when the injury site is much stronger and requires some stresses and strain to improve. By knowing your stage of healing, you will know how safe you are engaging in any given activity and be better able to tell if your pain response is exaggerated or disproportionate to your activity. But here's the big caveat. This is not free license to ignore your pain. This is because, Gillian said that we're healed at 3 months, so we don't have to listen to the pain. We can just push right through it. No. You still need to respond to your pain system by modifying your activity appropriately. In fact, many of my patients are dismayed when I teach them and show them how little activity it actually takes to set off their pain alarm signals. Starting out, they have to do a lot less than they're used to. This is called finding baseline. They had gotten so used to ignoring their pain and toughing it out. It's just that when you experience pain, you can change the interpretation of the signal. You will worry less and be in more control. A big part of retraining your pain system is that it needs to trust you. It needs to know that you have heard the message and are responding appropriately. Ignoring your pain system will only wind it up more. As time goes on, say greater than 3 months after an injury, treating your pain becomes less and less about fixing the injury source and more about breaking the pain cycle. What most people don't like to hear is that, unfortunately, with chronic pain, we don't just take the pain away and then life gets better. What we need to do is live better first, and then the pain improves. Fortunately, the pain cycle is the response to pain that includes several things that we have under our conscious control. Increased muscle tension. We can relax muscles. Breath holding, shallow or chest breathing patterns associated with pain. We can breathe deeply and use a diaphragmatic breath pattern. The characteristic pain postures and facial expressions, we can change those too. And of course, the thoughts and emotions that go along with pain. All of us are free to think whatever thought we choose. When we think and behave in a way that is incongruent with danger and pain, our brain learns that we don't need the pain signal anymore. The result will be either decreased pain intensity, or we get less bothered by the existing pain, and that's decreased suffering. So what is this ABC technique to ease? First, we want to start with something very, very easy that we can control. I treated a lady a long time ago that had a chronic old shoulder injury. In fact, her pain was burning. And her system was so sensitive that her shoulder would hurt with just even a gentle touch. So that's where we had to start at baseline. We started with setting off her pain alarm system by just having her touch with her own hand her shoulder, and then progressing from there. So when she felt the pain, because she knew that it was herself touching the shoulder, she knew she wasn't causing any damage or harm, even though there was pain. And so, knowing that, she could feel and experience the pain and still change her breath pattern to reflect relaxation. It is easy to breathe slowly when we choose to, is it not? And when she would feel her muscles tense up because of the pain, again, she knew she was safe, so she could relax her shoulders even though she was feeling pain. She could keep her thinking calm because she knew she was just touching her shoulder. It is easy to relax your muscles, and it's easy to just think a thought, is it not? Now, I wouldn't tell you to replace negative thoughts and emotions with positive ones, because you have the right to whatever thoughts that you choose. But if you do these little steps every day, frequently, then you will train your pain system and you will start to feel better. All of us have biases about how we see ourselves and the world, which create our reality. When navigating healing, pain, and the quality of our lives, these biases and perceptions play a huge role in our rehabilitation. These are influenced by our personality, who we are, our culture, who we're with, and our previous experiences. They will color our path every step of the way and may be part of the factors that can lead to or keep you in chronicity. It is important to know about them so you can question your perceptions as you go along every step of the way. Success in any endeavor is undermined by four things: fear and doubt, fortune telling the worst outcome, not taking responsibility for your own success or failure, and by not believing in yourself. These four psychosocial factors are the most common ones that will stop you in your tracks in your rehabilitation and recovery. I have some antidotes to all of these as well. Fear of movement is when you're afraid to partake in any activities because you think that you may re-injure yourself. So one antidote, or some antidotes, are to get good coaching from a healthcare practitioner whom you trust, learning proper movement patterns, core stability, and following the ABC guidelines that we just talked about. I tell all of my clients that when they're doing exercises or any activity at home, that you need to be able to breathe and smile. This way, you always know that your nervous system is calm and that you're not overdoing it. For the overwhelm and worry that gets associated with pain, especially chronic pain, it's about really understanding the stages of healing. And asking the question, is what I'm doing really dangerous? Also, taking small forward steps to ensure success to minimize flare-ups, which can also be scary. Perceived injustice is the degree that, you got a bad rap. Maybe you were injured for something that wasn't your fault or out of your control, like a car accident, or someone at work left the floor slippery so you hurt yourself. And you feel like you want to blame somebody. So for perceived injustice, the antidote is to always ask in any situation, what can I do to improve this? Or what is my best response right now? When we have chronic pain or injury, we often perceive ourselves as more disabled than we actually are. So the antidote to this is to own every victory along the way, even if your progression is just very small, like gaining 2 degrees of shoulder flexion. 2 degrees might seem like a piddly amount that you could just easily dismiss, but it's still 2 more degrees, and own the victory. It's important to focus on what you can do versus what you can't, and to set SMART goals with a strong association with a strong why you want that goal. If you don't know, SMART stands for specific, measurable, achievable, realistic, and time-defined. It's important to set goals in that framework. Sometimes we have injuries or illnesses that are permanent or degenerative. They just are never going to get better. For example, I have a disease called retinitis pigmentosa, from which I was legally blind for many years. It's a disease that has no treatment, no cure, no glasses to help you see better, and it's degenerative. It's got a pretty bleak prognosis. But somehow, I did improve, and I've stayed stable for just over 5 years. I fully attribute this to understanding the disease process as best I could, focusing on the aspects of my health that I could. I used stress management techniques, participated in yoga, meditation, and yoga nidra, goal setting with respect to reinventing myself as a teacher physio. Because as I mentioned, I was disabled for a time. I repeated positive and almost ludicrous affirmations and visualized my having healthy eyes. And don't forget about prayer. Prayer was in there too. Not so much about fixing my eyes, but to have the strength, the peace, and the patience to endure. I stayed realistic, but focused on appreciating the present moment and learning what I could from each moment. There's always something to learn, even in adversity. I couldn't afford to worry about what was to come, because that was pretty bleak, or to grieve over what I had in the past. But I had to figure out how to live the best way possible right in the now. And this is what I encourage everyone with an injury problem or a chronic pain problem to do, because we can impact our nervous system and our health by just being patient and persistent. We don't know who exactly will have chronic pain. We know that 10 to 15% of people with an injury will move on to have chronic pain. And we don't actually know why. There are no markers to identify people who have chronic pain or who will have chronic pain. But what we do know are the common characteristics of people who do have chronic pain. And by knowing what those are, then we can head them off when they start to go awry. It's important to know the stages of healing that you're in to make sure you're on track. Know that you can change your nervous system. It's in your power to do. It's not easy, but it is doable, which makes beating chronic pain possible. It's also important to keep it real. Our perceptions and biases sometimes aren't as accurate as we think they are. It's important to always scrutinize and bring yourself back to what's really objective about your condition. The best way to solidify what you've learned is to teach someone else about it. So I encourage you to go and tell 2 friends about what you've learned today in today's seminar. Thank you for attending this webinar. If you'd like to dive in and get even more knowledge and practice, you can check out my website for course details. Thanks again for coming.